I'm Joe Agostinelli, Social Media Manager at Greenway Health, and this is another episode of Putting Possibility into Practice, the podcast from Greenway Health. And today I am joined by David Heller, Corporate Counsel for Regulatory Affairs here at Greenway Health. And David, the Centers for Medicare and Medicaid Services are keeping you busy with some recent news, and talk about this recent news and how it affects providers and our customers here.
Sure. So recently, CMS released the proposed physician fee schedule for 2019. This is the first year we've really seen in the proposed fee schedule provisions for the quality payment program, and there's a lot of need into this. So CMS has been doing a lot of research over the past year in terms of what can they do specifically with respect to reducing administrative burden, what can they do to streamline reporting, and how can they make participation in programs like MIPS easier? We'll actually start kind of at a higher level. One of the first things they looked at in here, which I think has been a major pain point for many of our own customers, is evaluation and management coding, or E&M coding. So E&M coding is basically about laying down, what's the complexity of this visit and advice that I have to give to a patient. And there's a lot of different documentation requirements associated with that. Well, CMS has really looked at it as a huge administrative burden, and they've been thinking through how can we change this. And we have our first hints of what they want to adjust in this fee schedule over a multi-year period. So one of the first things they're looking at is possibly just creating two actual fee rates for E&M coding. So right now you have basically 5. They want to reduce that down to 2. So E&M level 1 would have its own billing rate, and then levels 2 through 5 would have their own billing rate. And the purpose here is with rates 2 through 5, or levels 2 through 5, what they want to do is just say you only need to document to satisfy a level 2, even if this is of a level 5 visit. So it's an attempt to really streamline that documentation. There are other provisions in there as well that kind of go back to are we compensating people properly for the time they spend. So there are new additional added G codes and HIPAA codes out there that look at, prolonged physician services and how long they spend with more complex patients. So tremendous amount in there with respect to E&M coding. This is all proposed to go effective January 1, so a lot to digest. They're soliciting comments. Strongly recommend that, patient-facing clinicians really do comment on this and take a look at these provisions, because it could have fairly significant impacts on their workflow. Other areas where we're seeing a lot of change is with respect to how they consider telehealth, or really what are considered non-Medicare telehealth services. So this is using communication tools, essentially to communicate with other providers or patients, whether that be a phone or a Skype meeting, things like that. And these are not going to fit necessarily under the Medicare definition of telehealth, which is subject to restrictions. And so they have this whole really technology-based new services that you can bill against, which is really about communicating with other professionals and with your patients kind of in between visits and using technology to do so. So that's a really neat revenue opportunity that we see for physicians that hasn't been there before. Another good thing to look at in terms of what are they asking for? Do you think those documentation requirements are sufficient, or do you think that they're too much, et cetera? So with respect to our day-to-day, quite a bit. MACRA, there's also a lot of changes there with the quality payment program. So from a high level, we're seeing a lot of changes in the quality category. Reduction of the number of process changes are being proposed. We're also seeing a lot of changes in terms of promoting interoperability, formally advancing care information, formally meaningful use. So that section has now had a lot of measures removed from it as well, mainly the measures that focus on patients using technology, so patients sending secure messages or patients seeing their health record. CMS really heard outcry that this is a really big barrier for physicians in terms of effective participation. So many of those measures have been removed, which aligns it with the inpatient prospective payment system's provisions for hospital or Part A use. Promoting interoperability with those measure removals is being scored in different weights, but the provisions focused on interoperability are weighted higher than they were in prior years to reflect the administration's new focus on interoperability as a whole. In terms of other changes we see, they're going to continue forward in terms of reporting periods, 90 days for promoting interoperability, 90 days for improvement activities. They're going to continue holding to full year for cost, full year for quality. The other area where I think is important to call out, the performance thresholds across the board have increased. So the MIPS performance threshold, the number of points you need to earn to avoid a penalty, in 2018 is set at 15. Next year it will be set at 30, or they're proposing to set it at 30. There's always also this additional performance threshold concept. So you do super well, you have the ability to earn extra incentives on top of your standard MIPS positive adjustment. Last year in 2017, that was set at 70. This year they're raising that to 80. I haven't gotten to the part on the guidance yet on why they're raising that, but I suspect based on some of their commentary so far around what they estimated the means for MIPS performance would have been in 2017, they predicted those means would be at 63.5 or between 63.5 and 68.98. That's pretty close to the year's prior additional performance threshold of 70. So they're trying to create a little bit of distance between exceptional performers and average performers. Lots and lots to unpack in this rule. Other pieces that are important to note, you have to be on 2015 certified EHR technology next year. That's required. Corresponding with that is the elimination of all the old transition objectives that used to sit beneath promoting interoperability or advancing care information. So this is a very, very meaty proposed rule, and there is really a lot in it that could impact the way physicians code day to day and the way people participate in quality programs.
And David, when we talk about it being a proposed rule, for those who may not be familiar with the process, what's the next steps now on this?
So the next steps, the rule is proposed, and it's going to be left open for comment on the Federal Register for the next couple of months. Comment period will close in September. And essentially what they want to do is they want to hear from the industry. What do you think in the rule? And throughout the rule, they actually call out what they're soliciting feedback on. After this comment period is closed, then CMS will go through the hard task of finalizing all the different provisions of the rule and reconciling the feedback they hear from the industry. Now, with respect to the quality payment program provisions, they statutorily have to deliver those final changes by November 1. And then from there, we'll enter a new cycle of new calls for new measures, new calls for input on implementation, et cetera.
And David, you'll have an upcoming webinar in the next couple of weeks, correct, on some of these changes that are in the proposed rule?
Yes. So we will be focusing on a webinar on the beginning of August, on August 1 at 2 p.m. Eastern on the changes to the quality payment program. We're going to really, really laser in on those sections. We won't be covering the telehealth stuff we just discussed or the E&M stuff because there's just so much in the quality payment program, and we'll be discussing a lot about how they've changed MIPS and advanced alternative payment models.
And not too soon after that webinar, on August the 1st, you'll be at our annual customer conference in National Harbor, Maryland, Engage 2018. And why don't you just briefly discuss what you'll be presenting at Engage and why it would be important for providers to be a part of those presentations?
Sure. So I am presenting twice. I'm presenting once on the Quality Payment Program, or MACRA, in 2019, and I will also be presenting on DC and U, which is really kind of my catch-all expression for things happening in DC, both with CMS and Congress that impact physicians with respect to health IT, but doesn't relate directly back to MACRA or the Quality Payment Program. So, what I'll be presenting at Engage will be very similar to what we talk about on August 1, outside of the additional material on DC, where we'll talk about opioids, telehealth, we'll talk about these changes in E&M, what we're seeing in the IPPS that could be significant, 21st century cures and interoperability, and other health IT changes that are occurring at the Capitol. And then I have a panel discussion with our customers and product management, discussing how we look at regulatory changes and how we try to translate that operationally to the business and to our products.
So for more information on the webinar coming up on August the 1st, you'll find that information soon on our website at www.greenwayhealth.com. And to register for Engage 2018, still not too late to do it, August 10th through the 13th at the Gaylord National Resort and Conference Center in National Harbor, Maryland. You can visit our website for all the details at www.greenwayhealth.com. Check out the schedule of presenters, including David's presentations, and once you register for the conference, you can then go ahead and register for the classes and presentations that will be made available throughout the long weekend. I thank David Heller, the Corporate Counsel for Regulatory Affairs, for being my guest on this episode of Putting Possibility into Practice. A reminder that you can subscribe to our podcast on SoundCloud, iTunes, and in the Google Play Music Store. Once again, David Heller, the Corporate Counsel for Regulatory Affairs at Greenway Health. This has been another episode of Putting Possibility into Practice, the podcast from Greenway Health. I'm Joe Augustinelli. Thanks for listening.